31 Stress and Coping Pharmacology. This one is short and sweet. Total 6 slides, including the cover slide. Okay, so you have your sedatives or hypnotics that produce mildest form of central nervous system depression. They're, they can use antidepressants, which we've covered before, atypical antipsychotics, which we'll be covering more in when we get to schizophrenia, so I'm not going to cover a lot here. Benzodiazepines, which I will cover on the next slide, non-benzodiazepines, also some over-the-counter Sominex, Tylenol PM, diphenhydramine, Benadryl. Your text has a chart 2065 with your antidepressants. We've talked about the SSRIs in the past, tricyclic antidepressants, also such as your meparine, also another common one is amitriptyline or nortriptyline. Those are some TCAs, tricyclics. Let's see. For panic attacks, tricyclics are recommended for the person with panic attacks. We've talked before about SSRI, so I'm not going to go into them more. Tricyclics block the neuronal reuptake. Monitor development of suicidal ideation, adverse effects including dizziness and drowsiness. Do not start an SSRI within 14 days of stopping an MAO inhibitor. Benzodiazepines. The action is to interact with the neurotransmitter, the GABA, to reduce neuron excitability, promotion and relaxation, decrease anxiety, promotes relaxation. Alprazolam, clonazepam, diazepam, lorazepam, temazepam. Do you recognize anything here? Azepam. Resveratrol is the only one here that's used as a sleeping pill. All of these can make them sleepy. Lorazepam seems to be the safest one in the older population. All of these can be addictive, become very dependent on them. Are not recommended for long-term use. They're actually supposed to be for like 4 weeks, but you see them all the time prescribed over and over, and people are totally addicted to it. It's a shame. They can have excessive sedation and dizziness. Use cautiously if they've impaired hepatic function. Monitor their liver function, your AST, ALT. Avoid alcohol in combination with any benzodiazepine due to the decrease in their functioning. They'll be very impaired. Both are CNS depressants, alcohol and benzodiazepines. There has actually been death when alcohol and alprazolam or Xanax have been mixed together. Sedatives and hypnotics for older adults. Identify the cause. Use non-pharmacological methods first. Short-term use, your text talks about escitalopram, temazepam. These are intermediate acting, so they take place over a longer period. I've seen the triazolam halcyon and temazepam used, resveratrol usually given at bedtime, so it's a longer acting. Avoid benzodiazepines such as diazepam or Valium, the elderly. I said that really it is the lorazepam or Ativan, which I have found is safer for the elderly population. So, non-benzodiazepines that are used, buspirone or Buspar, Zolpidem, which is Ambien. These are used for general anxiety disorders. Buspirone is like twice a day. It's for chronic anxiety. Zolpidem Ambien is often used. It's a non-benzo. A lot of people think of it as benzo. I think it acts like one, but it's not. It's a non-benzo given at bedtime. Problem with with zolpidem is the sleepwalking. It is huge risk of sleepwalking, even eating in their sleep, having no memory, because it has a short. It only lasts like 4 hours, so they wake up in the middle of the night. It's a drug I don't care for. Buspirone, I think, works a lot better. Side effects are both of these are nausea, headache, and dizziness. Both take several weeks for full effect. Caution in impaired renal and liver function. Okay, so the last slide, your beta blockers. Propranolol Inderal is the most common one used because it's a beta blocker, so it's reducing the sympathetic nervous system stimulation, blocking cardiac and respiratory beta receptors. Off-label use for anxiety and panic attacks. Usually is used in conjunction with other things because more studies are finding it actually decreases those symptoms of it but doesn't take the anxiety quite away. So it's often used in conjunction. Monitor their heart rate and blood pressure because it's blocking those beta cells in the heart also, so decreasing heart rate and in turn decreasing the blood pressure. Adverse effects are bradycardia, confusion, fatigue, and drowsiness. Often the person will take it at night. Caution, it masks symptoms of hypoglycemia, so great risk in that diabetic, especially if they're on medications. But this is something they need to take on a regular basis. And that is the end of this recording.